Hello, Anthony.
Yes, how are you?
Yes, I am doing well. It looks like you're not feeling so well today.
No, not today. My stomach. Well, I feel like I'm sick, but I feel like um, it's because of my stomach, though. You know what I mean?
The stomach is upset.
Yeah,
Okay.
yeah.
Okay. So I do have that we already got your vital signs, and luckily they were all within normal limits. You're
Yep.
not kind of febrile, there's no fever,
Yep.
anything like that. Blood pressure and everything like that was within normal limits.
Okay.
We also did the urine sample, and there's no signs of a UTI or urinary tract infection. There's no bacteria in your urine. So it's nothing that I would think would be a kidney infection or anything that we would need to be worried about your kidneys. We didn't obtain a stool sample, but you told the nurse that your bowel movements have been relatively normal?
Yeah.
Okay. So can you tell me when these kind of stomach pains or aches started?
Probably like a week or so ago.
Okay.
Yeah.
So time's about a week. And was there anything specific that happened? Did you eat anything differently that you don't normally eat? Did you maybe go out to a restaurant that you've never been to before?
I wouldn't say so. I'm usually a pretty normal eater, but it could have been something.
Okay. And can you describe to me what symptoms you're having exactly? Is there like nausea, vomiting?
Definitely. Yeah, I feel pretty nauseous. I threw up like a couple times like last week, not so much like the last couple of days. So.
Okay. Yeah. So it subsided.
Yeah.
And the emesis itself or the vomit itself, was it normal in color, like it looked like food? There was no bile, it wasn't green, no blood, it wasn't red or anything like that?
Definitely no blood, no.
Nothing that looked like coffee ground emesis, which would be like red coffee grounds, nothing like that?
No.
Okay. So probably not an indication of any sort of upper GI bleed or like a gastrointestinal bleed or anything like that. So likely not looking at anything serious. Okay, so currently no fever. I'm not going to put you on a bowel protocol at this time because your bowel movements have been normal. We did not do a hemostat. You don't need one at this time. And then the MRSA swab screening that we did was negative. We also did, I believe she tested you for RSV, flu, all of that was negative. So it's not any sort of respiratory infection that could potentially be giving you these gastric symptoms. So nothing to worry about there. Blood sugar was normal. So no hypoglycemia protocol needed at this time. So I'm going to ask you about some other symptoms that might seem unrelated, but again, I'm just ruling out any kind of overall viral infection that we might be having. So any ENT or ear, nose, and throat issues like excess drainage, itchiness, dryness, burning, coughing, swelling of the nose, throat, eyes?
No, I wouldn't say so.
Okay, so all of that is seemingly normal. I will have a brief look there. No blurring or any loss of acuity in your vision, correct?
No.
Okay. How about your muscles? Any muscle weakness, stiffness, wasting, any signs of muscle atrophy or kind of loss of mobility at this time?
No.
Okay. So all of that is normal. And then you did say you're experiencing nausea and you did actually vomit, but status post about 4 or 5 days with the vomiting. Okay. Did you have any diarrhea with the vomiting?
I think the first day,
Okay, so just about 1 day there?
Yeah.
Okay, and no abnormal urination, burning, anything like that?
Nothing like that, no.
Okay. All right, Anthony. Well, that gives me a little bit of a background to go off of.
Okay.
So if it's all right with you, I'm just going to set my clipboard here to use as a reference. And why don't we go ahead and get started with the physical portion of this examination.
Okay.
I did want to thank you again for coming into the urgent care. It's good that we're having a look. So I'm just going to move my chair out of the way for just a second.
Yep.
Okay. So I do want to just have a brief look at your kind of orifices, eyes, ears, nose, throat, just to further rule out any potential signs of infection here. So in the ears, just looking for any signs of excess earwax, which I'm not seeing on this side. Can I have you turn your head for me? Perfect. And I'm just going to be doing a very brief pupillary reflex test, so just look straight ahead for me. Very good. Taking a look at the nares. No signs of excess drainage, redness, or swelling. Can I have you open? Say ah, tongue out. Uvula is midnight, no signs of swelling or any abnormality in the tonsils. Okay. Just having a look at your throat. Can I have you swallow hard for me? Very good. Okay. So I'm going to go ahead and put on a pair of gloves. I will be beginning to touch you now.
Okay. That's fine.
And I'm going to start with just some manual palpations.
Okay.
I'll be kind of feeling around different areas. Let me know if any of it causes you any discomfort.
Yep.
Mostly checking for swelling of the lymph nodes and
Okay.
stuff like that, okay? So I'm going to do a little bit of palpating of your sinuses. Let me know if this causes you any pain or kind of pressure buildup feeling. Any abnormalities here? Any pain or discomfort in your jaw?
No.
Can I have you swallow again for me? Open and close your mouth. And again. Okay. Any pain or discomfort as I kind of palpate your pinna here? This
No.
part of your ear. Are you able to hear this?
Yes, I am.
Hear this?
Yep.
And this?
Yep.
Tell me left or right side?
Left. Right.
Very good. Can you open your eyes for me? Can you see my hand here?
Yes.
And here?
Yes.
And here? Here?
Yep.
See this?
Yep.
Look straight ahead for me. How many fingers am I holding up?
2, 3, 1, 5, 1, 5.
Very good. Okay.
Yep.
So no discrepancies there. Just doing a quick little test of your vision. So next thing I want to do might be slightly uncomfortable. I want you to stick your tongue out for me. Good. Just testing your gag reflex.
Okay.
All right. So all of your kind of ENT stuff looks normal. So
Okay.
I'm not suspecting you have any sort of respiratory virus. You don't have the flu. Your test came back negative. Strep test was negative. So all of that is fine. So we might be looking at either food poisoning
Yeah.
or some sort of gastrointestinal virus that might be going around, which is common this time of year.
Yeah, definitely. I think a lot of people from my job are out with some stuff too. So I'm thinking, you know, maybe.
Okay, so you might have caught something
Yeah.
there then. Okay. Just catching up on my notes here. Your ENT stuff is all clear. So the next portion of the exam is going to be abdominal.
Okay.
So I will be having a look at your stomach.
Yep. Can you take my shirt off or?
I will lift it up for you if
Okay.
that's all right, or we
Okay,
can
that's
just lift
fine.
it up to your chest, and then I'll make sure you're covered down here with this
Yep.
sheet. So just like that should be fine.
Okay.
And then we'll just kind of tuck this
Okay.
in. Is that okay like that?
Yeah, it's fine.
Perfect, okay. So first what I'm gonna do is just have a listen to your abdomen.
Okay.
Definitely wanna listen for any excess bowel sounds,
Okay.
any overactivity of the bowels, blockages in your intestine,
Okay.
anything that could indicate like a small bowel obstruction.
Yep.
When is the last time you had a bowel movement?
Yesterday, last night, I guess it was last night.
Okay. And is that normal for you?
Yeah, it's usually weird, but it's like 9, between 9 and 11. I think I go to the bathroom like one more time.
So most people's bodies do adapt to a schedule, and you start to
I
go at
think,
the same time
yeah.
every day. So that's good that there's not been any changes with that. Bowel sounds are normal.
Okay.
I'm hearing normal activity. It does sound like you're digesting some food now. You've eaten within the last 5 hours?
Yes.
Okay. Good. So I'm just going to place this directly over your belly button,
Yep.
just listening for any umbilical voice. Very good. Can I have you breathe in deep, hold the air in your belly?
Yep.
And release. Very good. And while I have this out, I'm just going to do some light percussing.
Okay. What does that do?
But that was just kind of percussing your intestines to
Okay.
see what feedback they give me, listening for a hollow sound. So
Okay.
anything that might sound rigid or stiff might
Yeah.
indicate a bowel obstruction, which would
Okay.
mean you have stool
Like
sitting
blocked.
that's not passing through.
Okay.
Yeah, so no indication of that. So let's do a quick test for symmetry. I just have a ruler here.
Yep.
And I'm just going to be making sure that you aren't experiencing any abnormal bloating or
Yeah.
swelling. Do you feel bloated more than usual?
Not really, no.
Okay. Okay, so you're fairly symmetrical from side to side. Just gonna take my calipers. Can I have you breathe all of your air out, protrude your belly as much as you possibly can. And now bring it in as far as you possibly can. Good. So do that one more time, out, out, out. And go in as far as you can. Good, okay.
Yep.
That is all normal. So the next thing I'm going to do is test for reactivity of your skin.
Okay.
So you're going to feel a slight kind of pinching with my tweezers. It shouldn't hurt, but you definitely will feel it. You don't have to do anything here. I'm just testing for normal reactivity in your muscles. So this basically sends a signal to your abdominal muscles, and we're seeing that normal reaction. And then this might be a little uncomfortable. I'm going to very slightly tug on the hair here. Okay. All right, Anthony, so if it's all right with you, let's go ahead and move on to a brief sensation test.
Okay.
And just looking for normal sensation of the abdomen. So I'm going to do that by testing a couple different tools here. So for the first one, I do want you to close your eyes. Tell me when you feel this soft sensation, okay?
Yep. I feel it. Feel it. Feel it. I feel it. Felt it.
Okay. And now when you feel sharp?
That's sharp right there, yep. Feel it.
Good, okay. I apologize, I know it's ticklish.
Yeah, sorry.
So I'm going to do a very brief sharp or dull. I want you to just tell me which one you feel.
Sharp. Wait, I would say that was sharp. The first one was kind of dull.
Okay.
Dull. 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 Sharp. 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 That was dull.
Good.
That was dull.
Okay. So there were just a few that you got incorrect, but you
Yeah.
were able to guess it
Yeah.
the next time around. Okay, so this next one is a little scratchy, but still soft.
Okay.
So I want you to just say yes when you feel it.
Yes. Yep. Yes. 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 Yes.
Any difference between this side and this side?
No.
Okay. Very good. So the next one I'm going to do is this light brushing.
Okay.
So this is going to rule out any signs of neuropathy. I want you to tell me if this feels abnormal, any stinging, burning, anything like that.
Okay. No. Oh. No.
Okay.
Felt normal.
And this one is called a Wartenberg wheel.
Okay.
It's fairly sharp. I'm going to run this along your belly in different directions. I want you to tell me if the sensation changes from one side to the other.
Okay.
So ideally it would feel the same bilaterally, which means both sides should feel the same.
Okay. Feels the same. Feels the same.
Okay.
Feels the same.
And here is the same.
Yep.
All around the umbilicus is the same.
Yep.
Perfect. And if we go horizontally, that's the same.
Yep. Yeah, I think my stomach's like used to like the sensations, so it keeps like
I'm
contracting.
sorry.
No,
That's
sorry.
good though. So we're getting normal reactivity in the muscles of your abdomen, which is what we want to see.
Okay.
If there was a lack of reaction or even an overreaction, then it could indicate a bigger problem. So Totally fine. So I'm gonna do some just percussing here. Again, just listening to the 4 quadrants of your abdomen. So you can tell that this here sounds different than this, and that's what we want to listen for. I'm going to do one here just on your breastplate, and then along your chest wall. Can I have you say 99 every time I tap?
99, 99, 99, 99.
And here.
99, 99, 99, 99.
Good. So the last reflex test I'm going to do on your abdomen is I'm going to have you close your eyes, and I'm going to run something along your stomach, and I want you to just let yourself react normally. Good. Okay. I know that's very ticklish, but we did get a good reaction there.
Good.
So the last sensation test I'm going to do here is just have you tell me if this feels cold.
Yeah.
Does this feel warm?
Yes.
Okay, so just tell me cold or warm.
Okay. Warm. Cold. Cold. Warm. Cold. 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 Warm.
And same coldness all the way across here. Okay, thank you. So I'm going to do some deeper palpation now. So you're going to feel me press in. Tell me if any of this gives you any discomfort or
Just a little bit there.
Little bit discomfort here. Here.
Not so much. No. A little bit there.
A little bit here.
Yeah.
Okay. So I am feeling some slight bloating in your lower abdomen.
It's like sometimes I feel the pressure.
Okay. How's your water intake been in the last few days?
It could have been way better, honestly. I think sometimes I was overcompensating, like the Gatorade. But I know I should have drank more water.
Okay, so that makes sense if you've been drinking more Gatorade than water. It's there's definitely a little bit of swelling here, which could be the salt intake. Gatorade is pretty high in sodium.
Yes.
And if you haven't been drinking water, so you're dehydrated and you're also retaining water, which explains the bloating and why you're a little uncomfortable here. You're just a little full. So I would hold off on the Gatorade, lighten up on the sodium intake, whether that's food or drink. Definitely drink some more water. Try drinking some lemon water.
Okay.
I'm not too concerned because you are having normal bowel movements. Bowel sounds are normal. But I do want to make sure that we're preventing any further damage. So I'm going to guess that this is likely a food poisoning incident.
Okay.
If it were a virus, I would think you would be having more diarrhea, more vomiting, because your body is not going to get rid of the virus until you expel all of it, unfortunately. With food poisoning, normally the sicker days come within the first 1 to 3 days after you consume the food, and then it kind of tapers down after that. Whereas with a virus, it'll kind of last all throughout until it's completely done. So I'm guessing that this is a food poisoning incident. Unfortunately, you don't know what it was, so I would just be careful with where you're eating. Likely wasn't something you had at home. Most people don't get food poisoning from their own kitchen.
Would undercooked food give you food poisoning?
Absolutely, yeah.
Yeah. I think I had some, I get chicken from my job, but I don't think it was it wasn't hitting it.
Maybe not fully cooked. Okay. And chicken, unfortunately, is one that has to be cooked completely to 160 degrees. Otherwise, you're looking at risk of salmonella, botulism, that kind of thing. Okay. Okay. Was it dark meat chicken by chance? Okay. So dark meat is harder to tell because it's kind of pink throughout. So even if it's fully cooked, it still has a pink tinge. Versus if you're eating like a breast or white meat, you can tell whether or not it's fully cooked. So definitely something to look out for. Also, undercooked chicken has a specific smell versus if it's fully cooked. So just something to keep in mind.
Definitely.
And you did say that other people at work were sick as well.
Yeah.
So they probably likely ate the same thing. Okay.
It's all making sense now.
Okay. All right, Anthony. Well, fortunately for you, I don't think this is a problem that's going to persist.
Okay.
let's go over just a couple of recommendations here.
Okay.
All right, so it looks like we are going to go ahead and say that you did have food poisoning, likely from something you had at work. So let's lay off the Gatorade for a couple of days.
For sure, definitely.
So if you were having more of like a virus, then I wouldn't be so against the Gatorade because it's going to help you, stay hydrated.
Yep.
Even the excess sodium will still help with depleted electrolytes. But because you're not having excess bowel movements or diarrhea, you're no longer vomiting, you're able to keep food down. Let's
Makes
really
sense.
try to stick with the water. I would say for the next 3 to 5 days, try to lighten your diet just a little bit. So something we call the rice diet. You can eat rice, bananas, things that are easier on your stomach, like white breads. Let's try to stay away from like pastas, potatoes, things that are harder for your body to digest. Stay away from any cruciferous vegetables. Let's stay away from anything like kale, spinach, broccoli, cabbage. Those things are very hard for you to digest. Up the water intake. Let's kind of stick away from acidic juices like orange juice, apple juice, pineapple juice for a couple of days. You can drink cranberry juice if you'd like. I would water it down slightly.
Okay, I can do that.
Try to stay away from excess spicy foods like salsa, things like that, just for the next couple of days. Bland diet.
I had fun with me.
It's
like stomach's not hurting.
And then fatty foods we definitely want to avoid. So anything fried. Try to use avocado oil or olive oil at home when you're cooking. Stay away from fast food for the next week or so.
I can do that for sure.
Do you need a prescription for anything right now? Like, I can give you some over-the-counter prescriptions for nausea medication, or if you're needing something more strong like Zofran if you're still feeling nauseous.
I'll take someone over the counter. I think it's just like, for me, the nausea is kind of like almost like unbearable sometimes. I know I'm being a baby, but...
No, that's fine. So why don't we go ahead and give you Zofran, which is actually a medicated nausea pill. Do you prefer the pill or would you like the lozenge? We have sublingual lozenge.
I'll take the pill.
Oh, the pill is
the pill's fine.
So we will go ahead and do that. I'll give you enough for 2 weeks just in case. You don't have to take it every day. Take it as you feel you need it. Okay, and then I'm going to go ahead and throw in an antacid just to be safe, and I would like you to take them together.
Okay, I can do that.
All right, Anthony. Well, I think you will be feeling better soon. I am going to give you a copy of this. You can take this up to the front desk. The nurse will give you your prescription. Pick them up at your local pharmacy. We'll send it over electronically for you, and you can also use this as a slip for work. Okay.
Thank you so much.
Thank you so much. I hope you start feeling better.
Me too.